Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. In today's video, let's take a look at how you can manage and heal water retention with natural and effective therapeutic tools. Water is crucial to your health, and it accounts to a big chunk of your body composition. Your body is made between 55 to 75% of water. And water retention is quite a common problem. You maybe experience swelling around your ankles, excess body weight, even aches and pains. So this is it. In this video, I will share with you great tips how your body can release excess fluids quite naturally. Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and your likes. Have a look at my website, medicanova.net, at the online academy, where you will find certified, comprehensive home study online courses in homeopathy, in mental health, health and wellness coaching, quantum healing, and so much more. If you need more information, contact me at health@medicanova.net. Before I give you the ins and outs, how to deal with water retention, let's take a brief overview around the anatomy and what is water retention really about. So when you eat carbohydrates, let's say a slice of pizza or a Danish pastry, which is basically sugar, the carbs are converted into glucose, and they're used to provide energy for your cells. It's like your gas station. You have to imagine it like that, and it's readily available always. The leftovers are then converted into glycogen, and they are stored in your liver or your muscle cells. So if you need more energy later and there's no glucose available because you haven't eaten carbs, these glycogen stores can be quickly broken down and turned into glucose for fuel, right? So you can run, or I can talk to you on this video, that all needs energy. But glycogen holds also a lot of water. Research informs us that 1 gram of glycogen holds about 3 grams of water. So as you can imagine, it can add up easily to increased sort of body weight. Now, dieting or increasing your exercise routine creates an energy deficit. And when there's not enough glucose available because you haven't eaten for a while, your body has to pull then from these glycogen stores in order to get the energy. So, of course, if you go on a detox diet or you exercise more, suddenly in the first or in the second week, you really lose weight. But then you hit the plateau, and that is because you lost water in the first place, and not just the fat cells are attached. So I want to share with you 2 types of water retention, because there are different causes or risk factors attached to it. One is called the pitting type of water retention. So when you press your finger in maybe around your swollen ankle and you see still the indentation of your finger, the depression we call it, or the pitting, then your water retention may be linked to more systemic disorders. For example, cardiac, heart symptoms, as well as liver symptoms, or absolutely most of the time, kidney weakness. It's very important that you check that out. If you don't see the depression, we call it non-pitting oedema. It's more linked to your lymphatic system or maybe thyroid disorders. See? So there are that makes it a little bit more complex. It's not just because you maybe had changed your diet, recently. There is maybe a story attached to it. So let's have a look at the symptoms, the causes, and the risk factors. Of course, it can vary from mild to severe symptoms depending on the underlying causes. Water retention can be a temporary situation, right? Women, for example, before their period maybe experience that, and then after a few days it goes. If you have changed your diet recently, that maybe affects you. You maybe also have heard excess sodium or too much salt in your diet can cause that, as well as a deficiency of proteins. If you're stressed and you're deficient in vitamin Bs, that can be part of it. If you have a sedentary lifestyle, you sit too many hours in front of the computer, right? You don't walk around, or hey, you sit on long flights, international flights, and you can't elevate your legs easily. That can be part of it. In cases where the person has to stand a long time, right, and the blood flow towards the heart isn't so easily, and here we have maybe the blood pools in the lower limbs, maybe because of insufficiencies of the valves, we call them varicose veins then, that can be part of it. So if you're affected by that and you have a job like that, I can maybe suggest, if it's possible, in your break, lie on the floor and put your legs up against the wall just for 10 minutes. That would help. We talked about congestive heart failure. Retention can be seen around the legs, the feet, and the ankles. Also, retention can be in the lungs if you have pulmonary edema, cirrhosis of the liver. Maybe we want to talk about that as well. Absolutely, kidney weakness, kidney deficiency. Often here you see more the signs around the puffiness around the eyes, the upper lid as well as the lower lid, particular swelling in the legs. We talked about lymphatic system, if there's lymphoma more underneath. But I would say thyroid disorders, hypothyroidism definitely causes this swelling and puffiness more around the eyes and the face. Of course, medications can also bring on water retention, hormone replacement therapies, oral contraceptive pills, drugs for diabetes, anti-inflammatory drugs, even for heart disorders. They do have a side effect of water retention, but as I said, in this video, this is an educational video, right? If you have something like that, more serious conditions which are part of your water retention, of course, please reach out to your healthcare practitioner. In females, commonly we see water retention before the cycle or the period. It's not uncommon during pregnancy as well. It's because the pressure is put on the uterus, on the circulation. Of course, it subsides after childbirth, but it can be quite uncomfortable. So, if I give you a brief summary about the high risk factors, it will be excess salt intake, protein deficiency in your diet, physical inactivity, hormonal changes maybe, heart failure, kidney failure, liver weakness, and medications. As I said, those with medical conditions contributing to fluid retention, such as heart failures or kidney disease, please, back it up with your healthcare practitioner. If you're interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's go in the second part of this video, the food for thought or the metaphysical meaning. Of course, if you have literal conditions like heart failure or liver cirrhosis, and it's part of the water retention. We not just can say, well, it's all in your head, but there is a mind-body connection. And if on a mental, emotional level, you feel like you are storing too many emotions or storing too many aspects in your life which you can't express, like the water retention, there maybe is a link here. And I would like to just give you some insights, maybe inspire you to look a little bit within what could be the cause of your water retention. Not to, it's with patients in my practice with water retention, particularly with women and swollen ankles, I do see that there is a tendency to hold on to stored up emotions. Yeah, and so in this case, I would like to refer to Jacques Martel references. He has some kind of nice thoughts about it. He relates water retention directly to the kidneys, because the kidneys are the organs of excretion, elimination of fluids, but also they carry a lot of fear and anxiety, especially about finances and future. So he says, my body makes reserves, like what I just shared with you with the idea with the storage of the glucose and the glycogen, which illuminates the fact that I may be able to store things or emotions because I hate losing something or someone. I keep my crying inside, so the fluids are kept inside. I show great self-restraint and take care to not bother others or my entourage. I avoid giving in to temptation, but this produces frustration and instability. My insecurity may be the unconscious reason for this stocking up. You see, there is a relationship here. It's like you store things and hold on to things. He says you may be also a little bit, prone to criticize yourself and others. This derives either from my difficulty in asserting myself or, on the contrary, from my ego, which is a little bit too big here and makes me take my own place and those of others. I thus disguise my anxieties, again holding on. My relationship with authority is also quite chaotic, and I often feel myself the victim of injustice. That particular aspect I've seen quite a lot in women with water retention around the ankles. They really feel like they're hard done by, something happened in your life which upset them, they hold on to it, and they're left sort of in a victimized role. So have a look at this. If there's something on that which resonates with your heart, then maybe it's time to release that within as well. So what would be the positive affirmation? I accept to take responsibility for my life and to learn respect and humility. A little bit better here. I learn to take the place that is mine by divine right, in the confident knowledge that everything is available so long as I ask for, right? You're not a victim of this situation. You can change it and you're not trapped. The fluid doesn't need to be trapped around your ankles. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths in achieving the very best of you, contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. So let's talk about the natural treatments here. Apart from understanding the situation, taking care of your mental and emotional aspects, taking natural supplements or the remedies I will share with you, you have to look at your lifestyle. because that's a big part here as well. And I mentioned to you that when you eat carbs, the glucose or the sugar is changed into glycogen, but the glycogen also holds, or 1 gram of glycogen holds 3 grams of water. So physical inactivity is one of the main culprits of water retention. So getting up, moving your body is one simple way to help reduce the water quite quickly and prevent body tissues on holding onto this excess of water. Exercising can also cause you lose water weight by burning up the glycogen, the stored sugar, to provide more energy. Not only does this deplete the glycogen stored in the liver and the muscle, but it also removes all the water that is attached to it, causing this water weight loss. So exercise is the first one. We talked about excess salt, maybe too much sodium in your diet. Sodium holds water. Most dietary guidelines of the Americans recommend limit your sodium to 2,300 milligrams per day. What is this? It's about equal to 1 teaspoon or 6 grams. I also would say slash all your processed food, because that contains a lot of salt as well. I mentioned protein deficiency. Yes, you have to eat protein. I'm not saying it has to be meat-based. It can be plant-based too, but make sure that you have adequate protein in your diet, because it's part of maintaining fluid balance and keeping water and salt from leaking out into the body tissues. Especially if you have a restrictive diet. I'm a vegetarian since birth onwards, so yes, I have to make sure that I have enough plant protein on a daily basis, so monitor that. Potassium is here also a factor. Like sodium, potassium is another mineral that involves in the fluid balance and may aid even in water loss by both increasing your urine output and decreasing the sodium levels. So that's part of it as well. Recommended daily dosage is 4,700 milligrams of potassium daily. Magnesium, also bring in more magnesium-rich food. That also helps with the regulation of fluid within the body. The average daily dosage is between 310 to 420 milligrams of magnesium each day. Stay hydrated. Of course, drink. You have water in your body and you think like, oh no, I shouldn't drink as much. No, because your kidneys need to flush out this excess fluid and they need to function, and that comes from staying hydrated. What is people ask me, so how many glasses of water should I drink? Most people need to drink roughly half of the weight in pounds or in ounces. For example, a 200-pound adult needs approximately then 100 ounces of water each day, but that can vary, of course, right? Don't overdo it. The main thing is that you drink regular, right? That you have throughout the day, regular intake of water, and that's important. To finish off this video today, I want to share with you some homeopathic remedies which you can purchase at your health food store, online. It's very easy. You not necessarily have to go through your medical system. It's very straightforward, but it's very effective. So homeopathic treatments for water retention can be very beneficial. Of course, as I mentioned in this video, a thorough investigation in each case of water retention needs to happen here in order to make sure that there are not really strong risk factors behind it. But in mild cases, remedies for water retention can be prescribed along with changes in the diet and lifestyle. That's a great combo here. But in cases, of course, where retention is associated with disorders of major organs, then homeopathic remedies are more part of a managing treatment. It's in conjunction, of course, with conventional medicine, but they offer support and often can reduce the symptoms quite quickly. I've seen that. Remedies for water retention not only help in providing sort of symptomatic relief in acute situations, but also assist in the treatment of the underlying causes. They stabilize it more. Treatment for water retention is very safe since the remedies are prepared, with natural substances. And there are really for all age groups, but in this video I want to focus on adults only. So for guidelines and schedule your appointment, contact me at health@medicanova.net. I'm happy to book you in and guide you more through this situation. But here's a tip how to take these remedies. I would purchase the potency 30. It's the number behind the name of the remedy. And in acute situations, maybe a tablet every 2 to 3 hours, maybe for 2 to 3 days. But for long-term maintenance, maybe a tablet daily for 3 to 4 weeks and see how you get on with that. But as I said, even water retention in itself, in combination with homeopathic remedies, should be taken under supervision. But here it is. I give you some remedies which can be very, very helpful here. And if you have a tendency to swollen ankles and you have the remedy at hand, you will see a drastic change within 1 or 2 days very easily. The first remedy I would like to share with you, it's called Apis mellifica. It's basically made from the bee, the honeybee. 30C would be the potency. And Apis is a fantastic remedy when you see this waxy pale, swollen ankles. The ankles are very sensitive to touch. There's a stinging pain, maybe stiffness may be present. It's the first remedy in mind when you see puffiness, also with this depression, this indentation, when you press your finger in and you see that, this white sort of like hole in there. It looks like it, but it's really just the depression of your fingertip. But that is a keynote of Apis. And in general, it's like because the ankle is so swollen, the skin looks quite waxy or sort of like stretched out. Another remedy in the sort of theme about swollen ankles is Apocynum cannabinum. That remedy you maybe have to order online. That's not really available in the health food store. Great remedy if we call it dropsicle. Dropsicle means it's swelling on the ankles, but that's related to cardiac disease. So I don't want to go into it here too much, but it's a fantastic remedy if there is heart condition present with the swollen ankles. Apocynum cannabinum. We talked about that different causes maybe, and I want to give you some ideas. It can be from sports injuries, it can be caused by arthritis, the swollen ankles. So I give you some choices of remedies where you can then get a hold of it. So if you have swollen ankles which are caused by arthritis, right, not cardiac or liver disturbances, just arthritis, I would choose the remedy Ledum palustre 30. Ledum palustre. It's a fantastic remedy. The symptoms, again, we have swollen ankles, quite hot to touch, painful ankles maybe. You feel the arthritic pain, maybe gouty affections even. It's a great remedy if you have gout in your first toe, in your big toe as well. And the pain worsens with warm application. So often they want ice packs on it. Ledum palustre is a great remedy. On the other hand, if you have a swollen ankle and it's caused by injury, maybe tipped over, or you were jogging and running, and the next day you feel like, oh my God, I have a little bruise around my ankle and it's even swollen. You see some bluish discoloration, I would choose Arnica montana. And the potency is 30C, but if you get a 200C, it's a faster effect here. And here would say with the 200C, 1 tablet 3 times a day. If you have a 30C, 1 tablet every 2 to 3 hours, maybe for 1 or 2 days. That would help really well. Arnica works wonders in resolving the swelling and the first inflammatory condition attending from or arises from injuries to the ankles. The ankles, as I said, are very painful, bruised, and sore to touch. If you are a jogger and an athlete, and I know you are aware that your ankle is affected, but now you have a sprain. And that means the ligament, overstretching of the ligaments happen. It's not just a little sort of tipping over and you have a bruise. No, you have real pain here because of the sprain. I would follow it up with the remedy Ruta graveolens 30C. 1 tablet every 2 to 3 hours, maybe for 3 or 4 days. In homeopathy, when improvement sets in, you stop taking more tablets. Right? But as I said, if you need more help, contact medhealth@medicanova.net. I would always start with Arnica montana first. Right? Get over the first initial shock of the tissues, maybe also on the mental emotional level, and follow it up with Ruta graveolens. It's a fantastic combination. In the first part of this video, I mentioned that when you have a situation in your life where you stand a lot and maybe also have a tendency to varicose veins, where the blood is pooling more in the lower part of your legs, particularly around the ankles, you want to talk about or think about a remedy called Homeopathic virginiana. It's a fantastic remedy. It's specifically indicated for varicose veins. So it's Homeopathic virginiana, I would say, is rated among the top homeopathic remedies for swollen ankles where the swelling is a result of varicose veins. Homeopathic works best in treating swelling of the ankles, also venous insufficiency. By then you would have a swollen, ankle, but also a lot of pain, quite engorged feeling, congested veins, maybe some itching even. Homeopathic is a fantastic remedy here. So I hope today's video has given you a little bit more insight about natural solutions. If you have a swollen ankle and you're not quite sure, is it the liver, is it the cardiac insufficiency, whatever, I would take Apis. Apis is a fantastic remedy. It works all the time, and at least it brings down the swelling right away. I had a friend recently who lives in the UK and traveled to New York and had swelling around the ankles, and was just there for a week for a vacation. And you don't want to ruin your vacation. She couldn't walk around, and Apis helped fantastically, brought down the swelling quite nicely. And then, when you're at home, you can discuss with your healthcare practitioner, what to do about the underlying causes. As I said, for more guidelines and to schedule your appointment, contact Medica Nova at health@medicanova.net. And lastly, have a look at my website, medicanova.net, at the online academy for your certified comprehensive home study online courses. I put the individual links for each course down in the description box, so it's very easy for you. When you click onto that, you guides you directly to the course, gives you a little bit introduction of what this course is about. Most courses are 16 weeks long. Yes, it's a long course, but I will guide you step by step. You can study from the comfort in your home. They're available throughout the year, so you can study at your own pace, but I'm with you all the way. It's very important for me that students have 100% attention here, and that's where you get the best results, right? So if you thought about, oh, I really want to know about homeopathy more, I want to study this, applying it for yourself as well as your loved ones and your friends, or if you are interested in a course during pregnancy, birth, and postnatal care specifically for that, we have a wonderful course here. If you always wanted to know about the fundamentals and the ins and outs about health and wellness coaching, I give you the tools, or quantum healing, or what to do with mental health. So here we talk about Alzheimer's, depression, anxiety, neurological situations. This is a course these courses don't require a prerequisite, but I will, as I said, with Zoom calls, with study materials, I provide everything what you need in order to feel confident to tackle the subject. So till next time, much love, take care.